Hello everyone. In the past video, we talked about anti-cancer drugs. We discussed all the major 8 classes or families, the major 8 families in cancer treatment. We talked about each family or class separately. We discussed the general mechanism of action. We discussed all well-known members of each family. We picked 1 or 2 well-known members from each family. We discussed their mechanism of action, their adverse effects. We also mentioned some of the tricky concepts which examiners like to ask students in, to see how far do you understand these drugs. When we discussed the 7th family, called monoclonal antibodies, we talked about all members collectively, but then I told you, we will specify a separate video for them because of what they have achieved. All social media are occupied nowadays with this new family called monoclonal antibodies, especially the drug which is making such a fuss on the social media nowadays. Of course, we can't let you get all of your information about this drug from social networks. That's why we are going to discuss this drug with a scientific approach and on academic basis. This new family, which is becoming extremely popular nowadays, is called PD-1 inhibitors or immune checkpoint inhibitors. For now, don't bother with the name, we will go step by step. Where did the idea behind these drugs came from? And by the time, you will understand all what you need to know. So consider this an introduction. A simple introduction so we can understand the mechanism of these monoclonal antibodies even better. So before we start, let's understand what does the name monoclonal antibodies mean. In the past decades, molecular biologists were discovering new proteins on cell surface each day. Either it is a cell or a hepatocyte. Each day, scientists are discovering new proteins. These proteins could be present on the surface of T cells, B cells, hepatocyte, whatever. That's why we now have extremely long list of proteins present on the surface of these cells, and the numbers are still growing, so that it is becoming exceedingly difficult to name those proteins. Even the nature of those proteins is becoming more complex. So should we call them proteins or receptors? Now scientists have discovered that these proteins have internal ligand, which make them responsive to some molecules inside our bodies, resulting in activation of these proteins, which will lead to sequence of events inside the cell. And this is known as signaling pathway that perform certain function. So now the challenge is not just about discovering new proteins, as this is becoming easier each day thanks to novel molecular tools, probes, and so on. But the real challenge is to understand its nature and what functions can this protein provide. So how do you think scientists are able to understand the function of proteins? In order to determine the function of a protein, you have to disable it first and spot if there is a change in the cell behavior. For example, if you want to study a protein within a lymphocyte cell, you have to disable that protein and observe the behavior of lymphocyte. If there is a change in its behavior, then you have something to begin with in your journey to understand the function of this protein. And this is what molecular biologists call as knocking down, which means you have to disable a protein to understand its function. So now you may ask, how can we disable a protein? Scientists say in order to disable a certain protein, we have to design a specific probe that can target it and shut it down. These molecular probes are termed monoclonal antibodies. Those antibodies are designed to target only a specific protein and react with it in order to shut it down. And when this happens, we can now have a glimpse on the function of that protein. Look here in this photo. You will see that each specific antibody attaches only to its specific protein and no other protein in order to react with it and stop it. Exactly like this, each one has its specific receptor. Each day now, research labs are discovering new proteins. Then they are designing a new monoclonal antibody that can shut it down. And monoclonal means highly specific antibody that cannot miss its target, in contrary to polyclonal antibodies, which are composed of many variants of antibodies that will disable many proteins at once. And of course, this won't help to determine the action of a single protein, so that's why we can only use monoclonal antibodies. These researches enabled us to understand the functions of hundreds and hundreds of proteins, as cells have so many proteins on their surface that we can't even count as the numbers increasing each day. Every day, with a new research, there is always a possibility to discover something new, and each day scientists are discovering new proteins present on the surface of these cells. This gives us so many options to interact with these cells. But as a drug, as we now know the function of many proteins and what will happen when we disable those proteins, we can now use monoclonal antibodies to disable proteins that are accused of causing a disease, and that is how monoclonal antibodies emerged to the surface of pharmacology as a new class of drugs. For so many diseases like rheumatoid arthritis, systemic lupus, and so many other autoimmune diseases, we now have a monoclonal antibody specialized in targeting a certain protein. This protein is accused in the pathogenesis of this disease. This is the background you need in order to understand the next slide. So now you know the story behind the name, and you are ready for the next two questions. The first one, which is confusing the scientists for so long: why our immune system does not attack our own cells? Our immune cells does not attack other cells in our body, a phenomenon called immune tolerance. Immune tolerance is a very peculiar term that means our immune cells recognize other cells in the same body as self cells, and that's why they don't attack them, but they attack other, stranger proteins. So the first question, why our immune system doesn't attack our cells, we need to answer this one. Now, some can say that in some cases our immune cells attack other normal cells in our bodies, like in rheumatoid arthritis, when leukocytes attack chondrocytes and destroy cartilage as if it were non-self protein, and in systemic lupus, when the immune system attack other tissue, and so on. Which will lead us to the second question, that is, why do some patients develop autoimmune diseases? Now we have on the screen three types of cells as an example of immune cells in our immune system. The first one is the T cell, which acts like the boss of the immune system. Second one is famous macrophage cell, and the third one is the underrated dendritic cell, or some may know as antigen presenting cell. And although it plays a role of utmost importance in our immune system, many students have little knowledge about it in comparison with macrophage or T cell. Now we will focus on those three types of cells and observe their function so we may be able to find a clue on why they may attack other cells, causing what is known as autoimmune disorders in patients with autoimmune diseases. And those two questions that we are talking about were the same that baffled this Japanese immunology scientist who has spent his entire life looking for answers for those questions. Why immune system doesn't attack cells in normal people, and why some people develop autoimmune disorders. In 1992, this man revealed a simple discovery that opened the door for more complex studies, and even earned him his Nobel Prize in 2018. This immunologist named Tasuku Honjo has discovered something we didn't know about before 1992. He has discovered that immune cells express certain type of protein. This protein was named by Honjo as PD-1, which means programmed death protein, as this protein activation leads to suppression of immune cells and prevent them from exerting their natural function. That's why it's named programmed death protein, as if it were killing the immune response, and can even actually kill the immune cells if it was significantly expressed. And the name 1 is because Honjo thought that we may discover similar proteins in the future. Now here is the interesting part. You know this protein activation leads to inhibition of immune response, but you may now ask, what activates this protein? What is the ligand of this protein? Honjo told us that this red protein termed PD-1 protein, and L here means ligand, is the key, as this protein is present on the surface of all your cells. So we have the answer to the first question, why immune system doesn't attack our cells. Now for the second question, why doesn't this protein that's found in all cells, either in the brain, kidney or liver cells, stop this immune response in autoimmune diseases? It is because those unfortunate people doesn't have this protein termed PD-1 ligand in specific organs in their bodies due to mutation in their DNA. For example, if someone has a mutation in his liver endothelial cells that prevent them from expressing the PD-1 ligand protein, when those cells are exposed to immune cells in hepatic sinusoids, those endothelial cells will get attacked by these immune cells, resulting in autoimmune disorder or autoimmune hepatitis. And that is the scientific base behind all autoimmune disorders. So any patient with autoimmune disorder has a mutation in the gene expressing PD-1 ligand protein, and this keeps the immune system unable to recognize cells and will attack this tissue, resulting in autoimmune disorder. Now scientists call this process of attachment between PD-1 and PD-1 ligand protein as immune checkpoint, which stop the immune cells from attacking other cells in the same body. And this is the answer to the second question. Tasuku Honjo didn't stop here, but he extended his studies to include cancer cells, which doesn't only express the same protein PD-1 ligand, but also other similar proteins that are capable of suppressing the immune response, making immune cells unable to recognize cancer cells as stranger non-self cells. And this is the reason why cancer cells can evade the immune response, although they are abnormal destructive cells. That's because cancer cells do express this protein PD-1 ligand and PD-2 ligand, inhibiting the immune response. Now scientists are trying to design antibodies that can stop the PD-1 protein or the PD-1 ligand protein in order to stop the immune checkpoint. And that is the topic of this subject, immune checkpoint inhibitors. Now scientists are trying to stop those checkpoints by preventing the process of attachment of PD-1 to PD-1 ligand to let immune cells able to recognize and destroy cancer cells, as we have subpopulation of T cells termed natural killer cells, which can destroy any abnormal cells. And when this experiment was carried out in animals by stopping these checkpoints, immune cells was indeed able to recognize and destroy cancer cells completely. However, as you may notice, when we stop these checkpoints in cancer cells, we are also stopping them in other cells, resulting in extreme side effects of these drugs that you may not hear about due to advertisement campaigns of these drugs that are trying to give hope to ill people. Of course, you as a doctor should be aware that if we stopped this checkpoint in cancer cells, there is a good chance that immune cells will also attack other cells, resulting in autoimmune reactions, which is a sure side effect of these drugs. And this has actually happened to some people on these drugs who complained of autoimmune lung injury, autoimmune liver injury, and so on. So you should always keep this extremely dangerous side effects in mind. In 2003, scientists started to try this class of drugs on animals and found very good results that enabled them to start trying these new drugs on varying groups of cancer patients. And now, let's have a glimpse on the most famous members of this class. And as you can see, they all come in vials with the same plan of treatment as one intravenous injection each 3 weeks. In 2012, this drug named nivolumab, and mab here refers to its monoclonal antibody nature, was started in humans and it resulted in mixed results, as some people were completely cured, others were partially cured, and some didn't benefit from this drug at all. So, in 2014, FDA approved this drug for commercial use, especially in lung cancer. And this is the first drug of this class that was approved for human use in 2014 for lung cancer. From then, so many drugs have emerged to the market and they all end with mab, which means monoclonal antibody. In 2021, the famous drug named Gimberli or Dostarlimab that was started on 12 rectal cancer patients with dose of 500 mg each 3 weeks, and it was a breakthrough in oncology science as all of the 12 patients were completely cured. As it never has happened before that a drug can completely cure all patients, and this opens a door for more research and improvement for this class of drugs as a possible cancer cure. Now back to the mechanism of action of the Gimberli, as it is now a rich source for exam questions. So let's revise what we said before. We know now that cancer cells express PD-1 ligand protein that binds to PD-1 receptor protein on immune cells, leading to suppression of the immune response, which will result in dissemination of cancer cells throughout the body. Dostarlimab, being a monoclonal antibody, binds to PD-1 receptor protein, leading to inhibition of the receptor, which will result in stopping the immune checkpoint. This Gimberli attaches here to the PD-1. This attachment means that it blocks this receptor, which was suppressing the immune response or preventing immune cells from recognizing cancer cells. And thus immune cells will be activated, recognize and destroy the cancer cells, especially in the rectum. Here is a photo of 4 rectal cancer patients. Of the 12 patients who went through Dostarlimab clinical trials and were completely cured. It is It is worth mentioning that rectal cancer didn't have medical drugs before, and surgery was considered the only line of treatment, and luckily those people didn't have any autoimmune adverse effects afterwards. That's why this drug is considered a breakthrough in medicine history. And this is why this drug deserves all of this attention, as it did indeed achieved 100% cure rate in its clinical trials. And this gives rise to two groups of people: the optimistic people who think of this class as a potential cure for cancer patients, and the pessimistic people who say that this trial is insufficient due to small number of patients, or what is known as small clinical trial. But let's side with the optimistic group due to the marvelous results of this drug that completely cures cancer. And this should urge research companies to develop more selective variants of such drugs, which can cure many cancer types in the near future.